Have you ever looked in the mirror and noticed a few new brown spots on your face or hands and wondered where they came from? They usually seem to appear out of nowhere after summer, after pregnancy, or simply with age. At our clinic, this is one of the most common concerns I hear from our patients. Those unexpected brown spots that seem to multiply over time. But they're not random. They are your skin's way of telling a story about sun exposure, hormones, and sometimes internal inflammation. In this video today, we'll talk about how these spots form, what they mean, and the best ways to treat and prevent them. Welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and an IFM-certified functional medicine physician. On this channel, I share health tips on skin health, food and supplements, functional medicine, surgery, and the latest medical research to help you feel your best. And if that sounds good, please like, share with your friends and family, and subscribe. So first, what are brown spots? Brown spots, sometimes called age spots, liver spots, or solar spots, are areas where your skin produces too much melanin, the pigment that gives skin its color. Melanin is like your skin's natural sunscreen. It protects deeper layers from ultraviolet light. But when your skin gets repeated sun exposure over the years, those pigment-producing cells, melanocytes, start working overtime and clump together. The result? Flat, tan to dark brown patches, usually on the face, chest, shoulders, arms, and hands. And these spots are not dangerous by themselves, but they tell a story about your skin sun exposure and inflammation. So why do brown spots happen? That's the next question, and that's the favorite question of my patients. And there are three main reasons. The brown spots develop for several reasons, and understanding which one applies to you actually helps choose the right treatment. So number one is sun damage, and this by far is the most common cause. Brown spots are really your skin's way of remembering every bit of sunlight it's ever seen. So decades of daily exposure, even from driving, walking the dog, or sitting by a window, add up over time. And as I noted earlier, UV light stimulates pigment-producing cells called melanocytes to make more melanin for protection. But after years of repetition, these cells begin to overproduce and clump together, forming these visible brown patches. And it's almost like your skin has a sun memory, and those dark spots are its photo album of past exposure. So the next cause of brown spots is hormonal. Hormonal changes can trigger brown spots, especially in women, of course, during pregnancy or with birth control pills. Estrogen and progesterone can stimulate the pigment cells, leading to a condition called melasma. So those larger, patchy brown areas often seen on the side of the cheeks, forehead, and upper lip. Melasma tends to get darker with sun exposure, heat, and inflammation. And that's why even something as simple cooking over a hot stove or taking a warm yoga class can make it flare up. It's not dangerous, but it can be very persistent, and managing it usually means protecting the skin year-round, not just in the summer. The next cause of brown spot is inflammation and aging. As we age, our skin becomes slower at repairing itself. So years of low-grade inflammation from pollution, oxidative stress, poor diet, or even chronic stress can damage the skin structure and disrupt normal pigment balance. And that makes pigment production less controlled and more uneven. So combined with slower cell turnover, old pigmented cells linger on the surface longer, creating that dull, spotted look many people associated with aging skin. And in reality, it's less about age and more about the cumulative effects of time, inflammation, and repair. So that brings us to the next question is, when should you be concerned about these brown spots? So most brown spots are harmless, but some can mimic early skin cancers, especially the type of thin melanoma that is called lentigo maligna melanoma. And here's when to see a doctor. If you have a brown spot that changes in color, size, or shape, if the brown spot looks very different from your other spots, and we call it the ugly duckling rule, that means that one spot is very different from many others in the same patient. A patient may have 1,000 spots on their back alone, So looking for an ugly duckling is part of skin check, and it's very important not to miss it. And the last important thing to look for is a brown spot that itches, bleeds, or crusts. So when I see a patient with these concerns, I carefully examine the area using dermoscopy, which is a special magnifying light that allows me to see pigment patterns and blood vessel structures beneath the surface. And that helps determine whether the spot appears benign or if it is suspicious and should be biopsied. And a biopsy is quick, done under local anesthesia, and gives a clear answer about whether the spot is harmless or needs further treatment. So early evaluation with dermoscopy and, when necessary, biopsy can make all the difference because caught early, most skin cancers are curable. That brings us to next section, which is treatment options. So let's talk about what can be done once you have these brown spots. First, let's start with the topical treatments. So they're often the first step, especially for mild to moderate pigmentation. So we'll start with the cream called hydroquinone. It's a prescription strength skin lightening cream, usually comes in 2 to 4% concentration, and it works by blocking tyrosinase, the enzyme your skin uses to make melanin. Apply it once daily to affected areas. It gradually fades dark spots over several weeks under medical supervision. And we often prescribe that for patches of melasma. The next one is very familiar, I'm sure, to many of you, is retinoids. So, for example, tretinoin. And they help your skin shed these old pigmented cells faster and encourage fresh new ones to form. And they also smooth the texture and improve overall skin tone. The next one is vitamin C, which is a brightening antioxidant, most effective in its L-ascorbic acid serum form. Serums are lightweight and they allow better penetration into the skin. So used each morning before sunscreen, vitamin C helps fade existing spots, boosts collagen, and protects the skin from new damage caused by UV light and pollution. The next one is niacinamide. It's a form of vitamin B3, most often found in moisturizers and serums. It's very gentle, making it suitable for sensitive skin. So niacinamide helps reduce the transfer of pigment to surface skin cells, improving this uneven tone and supporting the skin barrier at the same time. And it can be used both morning and evening and pairs well with vitamin C or retinoids. Incidentally, in one of my previous videos, I shared the recent research about another form of vitamin B3, actually an oral form that is called nicotinamide, that has shown to decrease squamous cell carcinoma, and I'll pin that video above. So niacinamide that I'm discussing today in the context of brown spots removal is another different and topical version of vitamin B3. So what procedures do we use to get rid of these brown spots? First, I have to say that there are really two main types of brown spots. Some people have just a few isolated spots, like a single, well-defined dark patch, or several of them. Others have a more diffuse pattern where the whole area, like face or hands, just covered. It's uneven. So for isolated spots, the best treatment is usually cryotherapy. This is a very quick and simple procedure done right in the office. A small spray of liquid nitrogen is used to gently freeze the brown spot. Within a few days, the treated area darkens slightly, forms a thin crust, and then flakes off on its own, revealing a clearer skin underneath. There's no cutting, no downtime, and it usually takes just a few seconds per spot. When pigmentation is diffuse, laser treatments are often the most effective as they target larger areas evenly and break down pigment beneath the surface. The laser treatments are more expensive, but they do work better for diffuse areas. Another option for diffuse discoloration is a chemical peel which removes the upper layer of skin and brightens the overall complexion. So the right approach depends on whether the pigmentation is localized or widespread. It depends on your skin type and also depends on your overall skin health. So now a few words about the functional medicine approach. From a functional medicine perspective, it's important to look at the root causes, not just the spots themselves. So chronic sun damage is often worsened by oxidative stress, poor detoxification of the liver, and micronutrient deficiencies like low vitamin C, zinc, or glutathione. So supporting the liver, eating antioxidant-rich foods and reducing inflammation through diet can help your skin repair from within. When your body is balanced, your skin reflects that harmony. So finally, how can we prevent these brown spots? So no treatment works if you don't prevent new spots from forming, and that means daily sunscreen to the face, even on cloudy days or through car windows and indoors. That's very important. Sunscreen to all exposed areas when in the sun and reapplication after an hour and a half to 2 hours. Wide brim hats and some protective clothing. Avoid tanning beds, of course, and regular skin checks, especially if you have many spots or if you are fair skinned or if you have history of sunburns. So in conclusion, brown spots may be common, but they're not inevitable. With the right care, protection, and attention to your overall health, your skin can stay clear, bright, and healthy at any age. I hope you enjoyed this video. Thank you so much for watching. Please like, share, and subscribe. I'm looking forward to reading your comments. Until next time, bye-bye.